So for starting new chapter of learning, I Pradipta Mitra being your host for today's event. Want to extend a warm welcome and good morning to all of you present here. And also I hope you all are doing good. So on behalf of SEMS family, I welcome you all for today's international webinar on the topic of men protection during pregnancy. And to add our guest of honor and today's speaker, Dr. Parul Priya ma'am. And it's a great honor to have you, ma'am. And we are grateful for your presence over here. So I also see quite a number of people are joining with us. Before I proceed, and let me take a brief moment of introducing about my organization. So, Since Welfare Foundation is a non-profit entity established to work in that like areas of education, social welfare, and women empowerment, skill development, and entrepreneurship, livelihood generation, and liability health, both empowerment of protection and similar sectors. We promote our healthy life and balance and active community and supporting businesses. So now I introduce today's speaker to you, Dr. Parupia. So she has started her education with the Netaji Subhas Medical College and Hospital, and done also education in Medical Institute of Kazakhstan and Medical Institute of like a Bachelor of Surgery MBBS with Biology and General Biology of Medicine of Surgery till 2022.
Thank you for the introduction. I'm Dr. Parul, and we are here to discuss about the topic like women in pregnancy, which is most common or which is a phase which comes in every women life. Okay, so first of all, for any girl or a woman, the reproductive age group is of from 13 to 50 years of the age group, and the pregnancy is a very common part of it. It can be like of early pregnancy and the late pregnancy. For early pregnancy, if the pregnancy is between 13 years to 20 years, or the late pregnancy is about like 35 years to 50 years. In the early pregnancy, the girl is very weak. For the body level, also, she is very weak. Her hemoglobin levels are very low, and her muscle strength also is very weak. She is not able to carry the baby, or the nutrition the mother gives to the baby. She is not able to do it, and also at the emotional level, she is not ready to carry the baby. Okay, uh, and for the baby also, it is not good because the mom is not ready. Because the mom is not ready, the baby is also very weak. He or she cannot get proper nutrition, or and for the late pregnancy, for late pregnancy, the mom is above 35 years of age, so she is like the my okay. So I was talking about late pregnancy. In late pregnancy, the age group is mostly above 35 to 50 years. And in that age group, the body is totally different. The mother is aging towards the old age. And so the body has the capability of the ovulation, that mitosis and meiosis, it decreases. So the chances of mutation increases very high. So the risk for the baby of having Down syndrome or any congenital anomalies. Congenital anomalies are like the anomalies or the problems with which the baby is born with. So it increases with age. And also for the emotional level also, it is very difficult because mostly in this age group, like for the 50 years of a woman, she's not like the society has the problem, um, that they will speak ki तेज में कर रहे हो and this and that. So for the late pregnancy also, it is different. So the best age group for the pregnancy is like from 20 to 30 years. And also before 20, the girl is very weak. So that's why the government has made the norm of making it of marrying at the age of 18 or 20. And after all of this, the pregnancy itself is a very complicated process and a task for the women also. And the society of India is like, we don't care so much about it. We always say that she's overacting, or she's doing her dramas. So the pregnancy is very difficult for, and also for the both of the sides of the family. So pregnancy is of 38 to 40 weeks, and in this also there is three trimester means the 3 months of 3 months of the process. So the 9 month pregnancy is of three trimester. In first of the trimester, the baby go in the mother's womb, and he or she gets develop all the body organs and functions. So basic development occurs in the first trimester only. And if any of the congenital problems like of heart problems or of kidney problems, if it occurs during the first trimester only. So the nutritional status of the women should be kept very good during the first trimester. Also, there are very negligence in the first trimester, because many times people can't remember their menstrual cycle, and they can't remember that uh, she's pregnant or not pregnant. So the detection or the diagnosis of pregnancy, it also takes some time. So in the first trimester also, the body hormones which shift from progesterone to HCG, and HCG is the hormone which increases the vomiting so much. So the mom needs the nutrition status high, and she can't eat or drink anything. So it is very important to take care of her, to provide proper support, care, and also the medical facilities too. And she also needs at that time the tablets of iron and folic acid. Folic acid is very important for the development of a baby's brain, and also and the neurons. So if she cannot get that iron and folic acid tablets, or supplements, or if her nutritional status is low, so the baby will get affected, and she will also get affected. So there is a saying, or the theory is that whatever amount of nutrition the baby wants, he or she gets it from the mother. But so the whatever we are giving it, so many people needs to get admitted during in the hospital during pregnancy, during the first trimester, because of the vomiting, because of the dehydration. And also the society needs to improve, it needs to change its thinking that it's not, pregnancy is not same for everyone. Someone can get more problems, and someone can get less problems. So it depends on the body, in on the hormones, and also on the each person. When the first trimester it ends, the second it ends into the second trimester. For the second trimester, basically the baby hearing abilities grows, and the uh, mood swings of the mother is very high because of the estrogen and progesterone hormones. The craving increases, and so we needs to take care of that too. The family members mostly. Mm, she also gets to take a proper medical checkup for the tetanus, for ultrasound. So in second trimester, we do that level 2 ultrasound scan. But the level 2 ultrasound scan is basically, that is also for the congenital anomalies, but that is more of the that baby is healthy or not. And for the mother, she is the one who is suffering, because the baby whatever it wants to take, ऐसा होता है कि बेबी को जितना चाहिए होता है उतना वो ले लेता है. सो जो भी न्यूट्रिशन डेफिशिएंसी होती है वो मदर को होती है, बेबी बहुत लास्ट में इफेक्ट होता है. सो हमें इस बात का ध्यान रखना चाहिए कि माँ को प्रॉब्लम ना हो. सो after the second trimester, the third trimester, which is the main problem, because it gets delivered at that time. Baby grows in size, it keeps on moving. Many of the time, it suppresses the vena cava, which is the vein supply of the mother's body. So when it suppresses that, the mom cannot get proper blood supply to her brain or to her heart, so she can have problems of like cardiac problems, or sometimes she gets to have that kidney problem, liver problem. And also sometimes she can get hypertension or diabetes in the pregnancy, which was not before. जैसे पहले से कभी कुछ भी नहीं था, पर आखिरी के 3 महीने में उसको बीपी की समस्या आ सकती है और डायबिटीज की समस्या आ सकती है, because the growing baby it increases the nutritional deficiency, and to that and to compensate that, liver also have to work hard, and pancreas also have to work hard. So it's very difficult for the mom to cope up with the situation, and the situation that diabetes in pregnancy and hypertension in pregnancy, it is also very difficult, because the hypertension in pregnancy, it has to be monitored, and which is very difficult in the rural areas. And for the diabetes also, we need to keep checking on that, because if the mother is diabetic, so diabetic means she has more blood sugar in her blood supply. So the baby gets more blood supply, more blood supply, and there is more sugar, so baby grows inside. The baby grows inside, and he also have the more blood sugar, so his pancreas also will have to work hard. So baby is very large inside, which is very difficult for the delivery. And for the hypertension, which is like, if the normal hypertension is 120 by 80, so if the hypertension increases to 170, 180, and if there is some like swelling in the feet, or if she has the blurring of vision, headache, these are all medical emergencies. So the patient or the women, they needs to be proper counseled about the problems in pregnancy, and how, and to inform to reach the medical centers as soon as possible. So, and the third one, or and the after all of these problems, then it comes for the delivery. So some of the times she gets the normal contractions, abnormal contractions for the delivery, or there are problems with baby too, for if she wants to go for cesarean section. For example, the baby might be in distress, or the amount of liquid which is in the amniotic fluid for the proper movement of fetus, which can be very low, and it has to be monitored. And for the delivery time, for the delivery time, the cesarean section or the normal vaginal delivery, it also takes problems, the complications. She has to give in so many medications. All medications have some effects, some side effects. Normal vaginal delivery is like, it is easy. Nothing is easy, but we can say that for the medical perspective, it is easy. But for the mother's perspective, she has to bear the pain for 12 to 15 hours or 20 hours before delivering the baby, which is very painful. She has to be very strong. That's why the early pregnancy, usually the young girls of 15, 16 years of age, they are not able to do that, or they can get fatigued if it is like that. For the cesarean section too, the mother gets to like, for the she has to be proper counseled, that for the baby it's important to be to go through the cesarean section. For the mother, it's very difficult to stay in 4 or 5 days for the in their hospital after the cesarean also. So counseling needs to be done from the starting to the end of these 38 to 40 weeks. And counseling, proper nutritional status, family support, emotional support. Many people does not understand it. They say, हमारे जमाने में तो ऐसा नहीं हुआ था, तुम्हें बस हो रहा है. But these are not good things to do, because the situation have changed. Our hormones levels are not like our parents, or the lifestyle we are living, it also not about like our parents or our grandparents. So we cannot compare that, or even to the other girl too, कि उसको ऐसा नहीं हुआ तुम्हें क्यों है. So it is, for example, while I work in hospital, many people come, they come for they want to go for the normal vaginal delivery. Like 2 3 days ago, I was dealing with a case. She was having bleeding since 12-15 hours, and she was having profuse bleeding. But why she was having bleeding? Because on the way of the delivering of a baby, the placenta was there, which was bleeding. Placenta is the one who gives blood supply to the baby, and it was bleeding very profusely. And it was no way that baby can come out without damaging that placenta. And if the placenta gets damaged, the baby does not get blood supply, and if he cannot get blood supply for 2 3 or 5 minutes, he can go in distress. We have to keep it in an ICU. But still, the family was poor, and they wanted to go for normal vaginal delivery anyhow. which was not possible for the medical team to do. So the proper counseling of why cesarean is needed, why normal vaginal delivery is uh, mm, not good, or why we should go for normal delivery. So it's important to tell them that. It's important to tell their parents or the family members how to manage that, how to manage the cravings and the mood swings also. Mood swings are very high during the pregnancy, and the cravings also. The mood swings are very high because of the estrogen and progesterone. Because when the progesterone surge occurs, it wants whatever, like the mind, whatever minds crave, it increases. But the mood swings also, like for example, every woman have experienced it during her lifetime. The mood swings, and which is the progesterone levels are mostly 100 times higher than normal times. So it is very difficult to control at that time. Women can have anxiety during that time, or the stress. So the environment should be kept quiet or loving. Most importantly, no physical violence or any kind of mental emotional blackmail or torture should occur during that time. And also for the baby, after 20th weeks, the baby can hear whatever is going outside, or he or she can sense whatever the mom is going through. So one have to keep the environment cool, or the husband should be supportive mostly during the pregnancy time. He or she should be supportive. There are also many problems, like she can get infection during the pregnancy because of the stagnation of the fluid. She can get many infections, which is harmful for, again, for the mom and the baby both. Baby can die intrauterine. So these are the parts where these are the parts during the pregnancy. Now for going like for the abortions part, which is also a very important part of this pregnancy. Abortions too are kind of many types. Many types means, for example, if she was pregnant due to any force or without any marriage, so she has the problem to go to doctor to tell doctor that I am pregnant. And now because अभी भी ये बहुत difficult है डॉक्टर को बोलना कि that I have pain in abdomen, but she was full term pregnant. So the pregnancy by force, or unwanted pregnancies before marriage, or even after marriage, unwanted pregnancy can occur. So the abortion part is also very important. Abortions part is also of like two, three types. We can go for any of the type. But most importantly, if the mom wants to keep the baby, we need to counsel her that if she wants to keep the baby, she can keep the baby. And there is also a time frame where in India, अभी भी बहुत सारे लोग बाहर करवा लेते हैं चेक कि लड़का है या लड़की है, और फिर उसके हिसाब से वो अबॉर्शन के लिए जाते हैं, विच इज वेरी रॉन्ग. Society needs to get equal about it, equal about girls too. So, first of the that this gender reveal is uh, very wrong in India, and we need to change it. But that another part. Abortions also, abortion has like, if the unwanted pregnancy is, we can go for abortion, or if the victim was pregnant by force, we can go for abortion. Or if there is any congenital anomalies, which is also, we can go for abortion, because for any baby which is born with some mental retardation, or uh, some different kind of other problems, we need to go for abortion, because for the baby also it is difficult, and for the mom also it is difficult for the whole lifetime. You cannot kill the baby after she is born. Sometimes the moms get emotional that no, this is my baby, it has got the heartbeat, I need to keep it. But for the long term, she will not have any life because of that baby, because at the age of 14, 15, he or she will have an mind of 1.5 years. At what age, till what age can a woman can do all the household chores of a like 1.5 year baby, which is increasing in size, which has a body of 14 years or 20 years, but her mind is of 1.5 year. Till how much time mom can take it? So for that also we need to counsel women and their family ki we, you should not keep it, or you should go for abortion. Abortion also in itself is a very traumatic procedure for a mom, because a kind of it's kind of her part is going different, like she's getting separated from a part of her body. That's why moms are very closely attached to the baby. So abortion part about it. So there are two three methods of the abortion. Like you all have known about the medical termination of pregnancy from which occurs by the medicines. All nowadays, many of the shopkeepers or many of the doctors' friends, they tell about the MTPs कि हाँ ये वाला ले लो, ये वाला ले लो, हो जाएगा. But the problem is you need to know about what you are taking and what are the effects, what are the side effects. So like when you like किसी ने एमटीपी ले लिया, खा लिया, पर उसने ना पहले डॉक्टर को दिखाया था ना बाद में डॉक्टर को दिखाया था. सो इट कैन हैपन कि उसके जो बेबी के कुछ पोर्शंस हैं वो या तो यूटेरस में रह जाए, या बॉडी के किसी भी, बॉडी के नहीं, लाइक रिप्रोडक्टिव ऑर्गन से किसी भी और पार्ट में रह जाए. तो ये बहुत मुश्किल है. फिर वो उसको लॉन्ग टर्म में कॉम्प्लिकेशन करेगा कि ये कैसे फिर उसके यूटेरस में अगली प्रेगनेंसी के समय में बहुत दिक्कत होगी, जो कि ठीक वो चाहते हैं प्रेगनेंसी में. तो एमटीपीज लेने के पहले भी डॉक्टर को कंसल्ट करना जरूरी है, उसके बाद भी एक अल्ट्रासाउंड करना जरूरी है. अगर अगर एमटीपी नहीं लेना चाहते हैं, दूसरे तरीके for like dilatation and evacuation we say. So dilatation and evacuation is we dilate the cervix and we just pull out the baby before it is viable. So this one is also a question ki, till how much time we can take out the baby, or it is not murder or murder if we take out the baby in the starting 1 or 2 months. So no, the baby is not viable before 20th weeks. If left alone or the left outside the body, he or she cannot survive it. So we cannot consider that in murder, because murder is you are killing something which is alive, or which is a viable, but it is not viable. It is before 28 weeks it is not viable. So we can, and now for the rule also we can go for MTPs till the starting 2 months or 3 months, 4 to 5 weeks. And if there is any abnormality or abnormality present, we can go for up to 18 or 20 weeks. In presence of 2 or 3 doctors, or after 2 or 3 doctors' opinion, not like anyone can go and have abortion in 20 years. One more problem is about it, ectopic pregnancy. Ectopic pregnancy is what, that the baby is there, but it is on the another part of the uterus. Like it is not in the uterus, it is somewhere in the tubes, it is somewhere in the ovaries, or at any other place. Mostly it is in the tube. So if the baby is in tube, but the tube is not ready to hold the baby, so the blood supply is very less there. The baby cannot grow there. So the blood supply, after some time, blood supply get blocked, and the baby will die, which is a result of ectopic pregnancy. Very less ectopic pregnancies are viable, but the problems related to it is very high, because the tube is a tube. It is not a muscular structure. It has not myometrium or endometrium growth to hold the baby, so it can get ruptured in the like abdomen. It can get ruptured, and when it gets ruptured, there is whole way bleeding. I have seen a case which was of ruptured ectopic pregnancy, which is an emergency in medical science. If it is not treated just in 1 or 2 hours, the mother can go in shock, and she can have hemoperitoneum. Hemoperitoneum is the blood which is leaking from the tube. It will fill the whole abdomen, and none of the abdomen organs will function properly because of the pooling of the blood. Other organs will not get blood, heart will not get blood, brain will not get blood. So we have to operate that, remove all the blood, clean all the clean the whole abdomen. Many of the women needs a blood transfusion during the ruptured ectopic. So it is very difficult situation for the mother, for the medical practitioners also, to save that mother. Also, so that's why it is important to have an ultrasound in the first 5 6 weeks, just when you meet your last cycle. You should go for the ultrasound, or even after the MTP kit, you should go for ultrasound, because some of the parts can remain there, which can cause a regular heavy bleeding. For example, there was a girl in her in 21 years of old. She was of 21 years of old, and she just got pregnant somewhere. She was not married, so she did not want to come to hospital, and she took MTP kit from some random shopkeeper. She took it. The baby got aborted, but there was a part of 2 centimeter only which was remaining in her uterus, and for that 2 centimeters she was bleeding from. She came to us in May. She was bleeding from February. For 3 months, she was heavily bleeding, and when nothing fell short in place, then she came to hospital. We had to go for dilatation and evacuation of the 2 centimeter product. But if she came to us in Feb only, uh, and after MTP kit, we would have done that ultrasound, and we would have known that they is still having that 2 centimeter product, and we could go for that. Uh, that too, for the we can give medicine for that too. But for 3 months, she was anemic too. Her hemoglobin was 7 grams. Normally, it should be in between 12 to 15 grams. So these are the problems in the rural India. After that, pregnancy also, for the when the baby got delivered, but the placenta did not get delivered, or the blood vessel which was supplying the baby, it was open. It occurs in, like, in diabetes, if the mother is having sugar, which was about which I was talking earlier. uh, she was in the case of diabetes, or in case of twin pregnancy, the uterus is very big in size, so the blood vessels are also big in size, and the baby got delivered, the blood vessels are ruptured. We give oxytocin at that time, and methyl esterone, and other drugs also, for that, to stop that bleeding. So no, most of the cases it stops, but in many cases it cannot be stopped, because because of the large uterus size, and it keeps on bleeding, mostly in cases of, if it is in small setup, or if the baby was delivered at home, it becomes a problem, a life threatening problem, of postpartum hemorrhage. In medical terms, it is called postpartum hemorrhage. So the mothers are at risk of the postpartum hemorrhage. Because of this hemorrhage, she can die too, and she can also need blood transfusion. And there are many other medical procedures which we do for stopping the bleeding. But it is important to know about it. It is important to prevent it. It can be preventable. In today's time, if someone is dying from postpartum hemorrhage, it is very sad to hear that, or very bad also, because now the medical science is good enough to prevent this postpartum hemorrhage. But still, in our hospital also, I see people. I have seen 2 3 women dying of postpartum hemorrhage, because of the heavily bleeding. The body, she is in shock. The heart does not have blood to pump. Her brain cannot blood pump. Uh, Her oxygen saturation drops very drastically. Even after blood transfusion, mm, we cannot we cannot we could not save the lady, because the bleeding continued, and it is like, how to say it? For example, when the bleeding occurs, and after sometimes the blood vessel get more dilated, because it wants more blood for the heart, but it does the opposite. It The bleeding continues and continues, and which is very harmful for the mother. Also, after the pregnancy, there are months like 4 or 5 months. First of all, she has to go for the breastfeeding, which is also for the first timer moms. It is very difficult uh, for the lactation to occur. Her hormones, the baby need to get the breast milk first, which is very important. For the 6 months, not even water should be given. Only breast milk should be given. So it is very important, and the new moms, it is difficult to get that. Also, just after the delivery of the baby, the hormones in the baby, in the hormones in the moms, it comes just to the baseline, just like in it is in us. So this drastic change in the hormones, it leads to other psychiatrical problems, which is very transient. Like we say that baby blues, baby cyanotic, and like this. So the baby blues are like for the in the starting 2 3 days, she does not know what happened to her baby. It is a psychiatrical condition because of hormones. She will get better after that, after some time. So postpartum depression also occurs because just the progesterone is also happy hormone. It keeps the mom going on the everything. So when it drops, the mom can get depression, or she can have anxiety. She will feel that someone has taken her baby from the womb because she was used to have that baby in her stomach for 9 months now. So just it is if it is taken in a just taken suddenly, she feels that someone has stolen her baby, or if her family is not supportive, she will feel that her husband has stolen the baby, or they have killed the baby, but the baby is fine. Somewhere she will get irritated also by the baby, the constant crying, the constant workload which has increases, breastfeeding, keeping, cleaning. Uh, the baby could not sleep at the time, or she has other works to do. Family usually is not very supportive. So these things are also very important. The postpartum taking care of the mother and the baby. Baby is usually taken care of by the family because everyone loves the new member. No one takes care of the old member. So it is also very important to take care of it, to know about it, and uh, to prevent. It cannot be prevented, but we need to take care during that period. To some women need some medications for the depression or the anxiety. Some women does not, they just get better. Many females, like if she has depression earlier, she will get depression in the postpartum phases, after the delivery of the baby. So overall, these are the complications which I wanted to talk about. If you have any questions, you can ask me.
Thank you, ma'am, for your wonderful session. Ma'am, the first question from the audience is how to maintain the hemoglobin level or the blood level during the time of pregnancy.
Okay, so hemoglobin levels are usually because of iron deficiency. In Indian females, it is basically because of iron deficiency. So if you are taking iron tablets, or the foods which is rich in iron, like spinach, or if you are cooking in that what you call that the utensils of iron, which is so basically iron supplement is important, and with proper iron supplement and nutritional status, like eat more eggs, eat some amount of protein every day, like which is in chicken or mutton, or eat fish, small fishes mainly. So with this we can maintain the nutritional status, and also the hemoglobin levels will also remain overall stable during the pregnancy.
So,
We can take supplement for iron too, which is usually given, but basically it's good that we take it from the nutrition.
and after the pregnancy, also the mother should continue with the iron supplements.
No, after pregnancy, usually it is not needed. Maybe if she was bleeding during the delivery time, or she was bleeding that time, then we can continue it for some time. Otherwise, it is usually not needed because the iron demands increase in the body during the pregnancy, because it is for the mom also, it is for the baby also. After the delivery, it is just for the mom, and usually it is taken care by the nutrition.
Ma'am,
Tablets are not needed.
Any tips for the mother who is having a pregnancy of 8 months right now, 7 to 8 months pregnancy?
What you are asking?
I'm asking any tips for related to the health or related to the fooding for the mothers who are having 7 to 8 month pregnancy right now.
For 7 to 8 month pregnancy, if her liver enzymes, which are they are in normal range, then she can eat anything, whatever she want. Just increase some, decrease some amount of spices. थोड़ा तेल मसाला कम खाना चाहिए। और क्योंकि प्रेगनेंसी में बहुत बार एसिडिटी की भी समस्या बहुत ज्यादा होती है, तो वो और लिवर एंजाइम्स अगर ठीक है तो वैसे तो कुछ भी खा सकते हैं, लेकिन एग्स खाएं, प्रोटीन्स लें अच्छे से, दाल खाएं, चना खाएं, छोटी वाली फिश खाएं, तो ये सबसे सही है।
Okay. Thank you so much, ma'am, for the wonderful and informative session.
Thank you, ma'am, for sharing a wonderful knowledge with us. And I hope the audience learn many more new things with this session. And once again, I would like to thank you for joining us and sharing your experience with us and precious time and knowledge.